I'm Caroline Caulfield, and I'm going to introduce our study exploring the experiences of families of Latino children newly diagnosed with autism spectrum disorder. First, I'd like to acknowledge my co-authors and co-investigators, Dr. Deborah Spitalnik, Dr. Jill Harris, and Dr. Manuel Jimenez. It's well established in the research literature at this point that there are disparities in the identification of young Latino children at risk for autism, and that this is often coupled with late connection to intervention and services or a lack of connection at all for these young children and their families. Previous work has explored this disparity and has identified several barriers experienced by Latino families, including limited knowledge of child development, limited knowledge and understanding of autism, having experienced bias from providers and other professionals, lack of clarity about next steps, both what next steps are and how to take action to achieve those next steps, and difficulties finding providers who speak their same language, as well as accessing developmental screening and other monitoring in their appropriate language. So this study takes a deeper dive into the experiences of Latino families from first identification of developmental concerns through the receipt of an autism diagnosis and the early connections with services. And we do this concurrently, very near to when the autism diagnosis was received, whereas most of the previous research into this topic has questioned families and interviewed families retrospectively a few years after the diagnosis has been made. And we were very intentional to include a stakeholder advisory committee of Latino women, both professionals and parents, to advise us throughout the research process in helping us to shape our interview questions, to validate the themes that emerged, and to clarify some of the implications of our findings. So we conducted semi-structured interviews with 20 families of 21 children, including one set of twins. 18 of the interviews were conducted in Spanish. And we recruited families at the time of their first follow-up appointment following an autism diagnosis, typically about 3 to 6 months after the diagnosis was made. And families were invited to participate in the study until we reached a point of data saturation or were no longer hearing new information during the interviews. And 3 major themes emerged from this study. And what you see on the screen before you are some representative quotes that really embody each theme. And we invite you to read the paper for a more nuanced presentation of each of these themes. And so theme 1 was that when parents first shared their concerns about their child's development, they felt unheard. The second theme, parents were surprised that the diagnostic process for autism relied on parental description of child development and behavior, observation of the child, and not on medical tests. And the third theme, receiving an autism diagnosis was a life-altering event for parents, and how that diagnosis was communicated by clinicians had a significant impact on families. So there are several clinical implications from these findings. The first is really just an underscoring of the importance of communication throughout all phases of this process, from development of concerns about a child's development through diagnosis. Communication, both in terms of really listening to families, but also clearly sharing enough information with families so that they feel activated to take those next steps and have a good sense of what to expect throughout this whole process. It also further validated the need to validate parental concerns. We know that dual language learning is a complex issue, but it is not a reason to delay referral if families are concerned about their child's development. And these findings also really underscore the need for the use of validated screening tools to screen for developmental delay. These findings also point to parent navigation as a potential model to help reduce some of the barriers that Latino families may experience throughout this process. So future research should explore patient education and navigation interventions. We need to develop, refine, and further validate better screening tools that are validated among diverse populations. And we need to further explore the identification and diagnosis of autism among children who are dual language learners. So thank you so much for taking the time to listen to this, and we hope that you read our paper and we welcome feedback.